Hello everyone, greetings for the day. So today the session is about canine anesthesia under the field condition by Dr. Deepak Suthar sir. It is our privilege to invite everyone to the session. Dr. Suthar sir has 20 years of clinical experience and 10 years of teaching experience. At present, he is serving as an assistant professor at Vanbandhu Veterinary College, Navsari Agriculture University, Navsari. So, moving forward, I would urge Dr. Deepak sir to start the session. Please, sir.
Good morning and first warm welcome to all the friends. Thanks to organizer of this event, Dr. Nilofar Desai, who provide the opportunity to share my knowledge with you. At the end of this webinar, organizer team will be provided whole PPT with ready-made chart of calculated anesthetic protocol as per the body weight and nicely prepared anesthetic album to your email account. So don't worry about the material. Now start the webinar on canine anesthesia under the field condition. Canine anesthesia is a vast topic and it is impossible to cover each and every part. This webinar is totally on practical approach, so no cover the mechanism of actions of anesthetic drugs and how it's work. Dear friends, why I am selected this topic for webinar? Now start xylazine and ketamine. What diazepam and ketamine. This most commonly used anesthetic protocol in canine under the field condition, which face many complications by our field veterinarians. On other hand, the latest anesthetic drugs and techniques introduced in veterinary anesthesia at the institute level. So it indicates very big gap between the field and institute level regarding the use of this anesthetic protocols. Through this webinar, I will try to fill this gap, and I hope this webinar is helpful for replacement of these old combinations with this new combination of the drug. Xylazine. So this slide shows the brief summary regarding the participant response received by the Google registration form, and large number of the participants from India and abroad shown interest and registered. One more important point received from our participant: all three types of the anesthetic method used or preferred by the canine practitioner. So this slide shows. So everybody know that veterinary medicine has often lagged behind the human medicine. Any new things, the first introduced in human medical field, then enter into the veterinary fields, like ophthalmic surgery, cardiac surgery, and orthopedic surgeries. Many more examples is there. However, the modern veterinary anesthesia utilize the many of the drugs and methods which are utilized in human anesthesia. So this is a proud moment for us. So now come on the seminar topic. The term anesthesia derived from the Greek word, and description of the anesthesia is very simple, means the loss of the sensations to the entire or any part of the body. So it's basic requirement to the most of the surgical interventions, both in the human as well as the animals. So pain is a main fear factor regarding surgical interventions in human patients. An anesthesiologist can abolish the pain reflexes in the form of the analgesia in association with amnesis, unconsciousness, and muscle relaxations. These are the characteristics of the general anesthesia, which can be fulfilled by using the different anesthetic methods and drugs. So surgeons can perform successful surgical interventions with the maximum concentrations after complete anesthesia the patients. Then finally, the surgeons can start the surgery, means surgical interventions, after positive signal received from the anesthesiologist. So now come on the duty of surgeons in humans and veterinary professions is quite different. In our veterinary field, the duty of the surgeons and responsibility of the anesthesiologist, both the duties are very well performed by the single man of our field veterinarian. So this is one of the biggest limitations in our field. So that's why the basic the knowledge of anesthesia is not sufficient for the veterinary surgeons. So to improve our skills regarding the administration of the anesthetic drugs and also develop the eagle's eye for the sharp monitoring of the patient during the surgical interventions. So everybody agree with me? Veterinary medicines depends more on anesthesia than human medicines. So many clinical procedures like oral cavity examinations, radiographic examinations, and inspection of the ear canal generally no need to anesthetize the human patients and cooperative very well to the clinicians. So just imagine our furious animal. So anesthetize the canine patient is our routine clinical activity. It's due to the uncooperative nature of our patients. And hardly the 1 or 2 minutes works require the general anesthesia in canine patients. And the story of the wild animals are totally different. Even for the collection of the blood and simple wound dressings require the anesthesia. So this slide justifies the importance of the anesthesia in our field. Mainly the two type of the clinical activity performed in our clinics. One is the minor clinical procedures and other is the major clinical procedures. The minor surgical procedures like dental scaling, incise the abscess, certain diagnostic procedures like the radiographic examination, and the therapeutic procedures like the pericardiocentesis in canine can be performed under the state of the tranquilizations and sedations using along your combinations with the other preanesthetic drug. The prolonged major painful surgical procedure must be performed under the general anesthesia using the ketamine, your thiopentone, your propofol, your etomidine as an induction agent and propofol, your isoflurane as a maintenance agent in combination with the preanesthetic drugs. So classification of anesthesia is generally the mugging and boring subject, but I am sure this classification is not bored to you, and it's totally based on the depression activity of the brains. Means the central nervous system depression activity of the brains is considered for the classifications. So generally the three type of the central nervous system activity performed by our brain, like the mild, the moderate and severe depressions, the activity of the brain after inducing the specific class of the drugs. I will give one example, give the better idea and understanding about the central nervous system's activity of the brains. So example wise, consumption of the alcohol which depress the central nervous system's activity of the brains depend upon the dose of the pack. So depend upon the dose, it's increase increase and decrease the depression activity of the brains. And tea or coffee is very good example of the central nervous system's stimulant. So now start the mild depression of the central nervous system activity by using the following tranquilizer drug. But most of the tranquilizer drugs are antiemetics and antileptics and generally used during the traveling with your pet animal by car, or by road, or by railway, or by plane for calming and reducing the risk of the motion sickness. And this group of the drug is also used for the prevention of the seizures as an antileptic drugs. So limited number of the tranquilizer drugs are available which use in the anesthetize the canine patients as a pre-anesthetic drugs. And many times the field veterinarians demanded, sir, which oral medications is used for controlling or restraining the furious and restless animals. So dear friend, no any tranquilizer drugs will be fulfill this requirement as a form of the oral medications. Means a sole agent of the tranquilizer drug does not provide the satisfactory result in canine. But this agent gives better result. It's used with the opioid drugs like the butorphanol, your Premedication as a form of the neuroleptic analgesia. So neuroleptic analgesia means the combination of the butorphanols and combinations of the tranquilizer drugs with the opioid drugs. For that reasons, I will recommend it always use this group of the drug with the opioids, so give better results. So number of the example of the neuroleptic agents like the injection diazepam used with the injection butorphenols, your tablet diazepam used with the tablet tremedals give the better results as compared to use as a alone agent. So next one is a moderate depression of the central nervous system's activity of the brain. So it's achieved by using the sedative drugs like the xylazines, ditomidines, miditomidines and dexmedetomidines. So out of these 4 drugs, so xylazines and dexmedetomidines available in the Indian market, and xylazine is most commonly used in the veterinary practice, while the dexmedetomidines is the most commonly used in the human being, but this drug is also introduced in the veterinary practice. So minor surgical procedures, some diagnostic procedures and therapeutic procedures in canines can be performed under the state of the sedations using the xylazine. So xylazine is work as a sedative. For better and powerful effect of xylazine, you can use these drugs with the combination of the butorphenol to achieve the greater degree of the sedations and analgesia, because the xylazine singly no produce any analgesic effect. So combination with the opioid drugs means opioid is a powerful analgesic drug. So combine both these drugs give the better effect. Next one is a severe depression of the central nervous system activity of the brain with unconsciousness, analgesia and muscle relaxation as a form of the general anesthesia. See, so these all are the characteristic of the general anesthesia. So general anesthesia can be achieved by either by the intravenous anesthesia or inhalation anesthesia. So inhalation anesthesia can be achieved by the administration of the volatile anesthetic agents like isoflurane, sevoflurane, halothane by the inhalants, means through the respiratory systems, while the intravenous anesthesia can be achieved by the administration of the drugs via injectable routes, and the result in the loss of the consciousness of the patients for a specific time durations. And the duration of the anesthesia generally depend upon the type of the anesthetic agent is used, and repeated injections may be given to maintain the anesthesia, or else it may be continued by the continuous rate of the infusion or addition of the inhalant anesthesia. Next one is a severe depression of the central nervous system activity of the brain with unconsciousness, analgesia and muscle relaxation. The injectable anesthesia is further divided into 2 types. So one is single bolus dose as a form of the repeated bolus dose, and second one is a continuous dose as a form of the CRI, means the continuous rate of the infusions. So continuous supply of the anesthetic drugs. So these are the general classification of the on injectable general anesthesia. So 2 types, single bolus dose and continuous bolus dose. Now come on the advantage and disadvantage of both the techniques. So intravenous anesthesia is very simple and easy the techniques, and requiring no any sophisticated instrument, only series and needle is sufficient for the administration of this drug. But some disadvantage is there. It is associated with the prolonged recoveries and recumbency time because of the cumulative effect of this drug. On other hand, the inhalant anesthesia is considered safe for the maintenance in the long and risky procedures. So as it provides the well control the depth of the anesthesia. You can control the depth of the anesthesia by the change the dial of the vaporizers. So if you increase the depth of the animal, so you can easily change the depth of the anesthesia at any times. But such type of facility is not available in the injectable anesthesia. Then rapid recovery is observed once you stop the inhalation anesthesia, and within the 10 or 12 or 20 minutes animal recover it. So recovery is generally fast in inhalation anesthesia, and it's less toxic to the patients when compared with the injectables, the anesthetic agents. So generally in the liver affected and kidney affected animals is safer for the inhalation anesthesia. Even in the neonatal and geriatric patients is also safe in the inhalation anesthesia. So prolonged means long and risky procedure you can easily perform under the inhalation anesthesia. This is the main advantage of this technique, but some disadvantage of this technique, inhalations. So it is a very sophisticated instrument, means the complicated circuit is there. So well aware about this instrument, awareness is very important regarding the use of this inhalation anesthetic machines, and constant monitoring of the patients is must be required. So one skilled persons. So constant monitoring of the patients and constant monitoring of the inhalation anesthetic machines. So small animal anesthetic machines is another disadvantage is it is costly instruments. So near about the 10 lakh rupees. So limitations of our field conditions, and finally the one disadvantage is pollute the environment, specifically the halogen. So powerful scavenger system is required. So many type of the small animal anesthetic machines available in the market with the complicated outer looks. So my concentrations on outer look of the machines, not the inner. So inner side is all the machines, means basically inner side is the same in all machines. So circuit is same in all machines, but the outer side is very complicated. So many times the young clinicians purchase such type of the instrument, so cannot adjust this complicated circuit. So wetlands small animal anesthetic machines available in our department, and this is very simple from outer looks. So very simple looks from outer. So no confusing regarding the circuits and how it work it. And we are using this machine since the more than the 7 years with the zero maintenance. So no maintenance, no electricity is required. So this machine is very simple. So I recommend it for that wetlands machine. It is very easy for the using it. So those persons who are interested in purchasing the small animal anesthetic machines for the small animal practice, contact our department. I welcome to those who are interested, and I will ready to give the demo of these machines and how it work it, and give some tricks regarding the using of these machines. So advantage and disadvantage of both the techniques, so injectable as well as inhalation anesthesia. So what is the solutions at the field level? So some limitation of the field level is there, and some disadvantage of this technique is there. So at my level, the solution of these problems by inductions of the anesthesia is carried out by the single bolus dose of the intravenous anesthesia using the short-acting injectable anesthetic drugs like thiopentone, your propofol, your ritonidines, whatever available in your region, and subsequently the maintained either by the continuous rate of the infusions as a form of the CRI or through the inhalation anesthesia in small animals in the practice. Now come on very important point, how to achieve the general anesthesia in canine patients. So generally the 4 steps of the general anesthesia follow step by step. So first step is the pre-anesthetic stage. So this stage is achieved by using the pre-anesthetic drugs. So it is very important the stage for preparation of the animals for the induction of the general anesthesia, and some ill effect of the inductions as well as the maintenance agents is reduced by through this phase using the pre-anesthetic drugs. So second one is the inductions, the phase of the anesthesia. So this phase is generally used for the inducing of the anesthesia and for the endotracheal intubations. And after that, the third phase is a maintenance phase of anesthesia. So whole the surgery is maintained during this phase, either using the propofol or any other injectable drugs as a injectable dose, means a repeated bolus dose, your continuous means infusions rate, And after the completion of the surgery, means they stop this infusions, they stop this inhalations anesthesia, means stop the bolus dose, then start the recoveries, means animal recovers after that period. So recovery is the last period. So generally it is a very critical period. Recovery is very critical period. So careful examinations is a must be needed. So now the one by one discuss all these steps for a better understanding of the stages of the general anesthesia. So first one is a pre-anesthetic stage. So my question, the first is, what is pre-anesthetic stage? So pre-anesthetic stage means it is a period before the induction of the actual anesthesia is induced, and this stage can be achieved by using the following pre-anesthetic drugs. So pre-anesthetic agents administered prior to the general anesthesia, and it prepares the patient for the general anesthesia. So now clear what is the meaning of the pre-anesthetic stage? Clear it? Okay. So pre-anesthetic agents are essential part of the safe anesthetic management. So when you use it appropriate dose, they minimize the stress, means reduce the stress of the animals. It also the minimize the cardiopulmonary depression activities. So it stabilizes the cardiopulmonary activities. So require the minimum dose of the inductions as well as the maintenance. And it reduces the ill effect of the other drugs. So certain drugs produce the ill effect. Likewise, the thiopentone and propofol, these both the drugs are respiratory depression drugs. So if you give the pre-anesthetic drugs, so reduce the dose of this both the drugs. So generally the thiopentone is a 10 ml dose. The normal dose of the thiopentone is 10 milligram per kg body weight. And propofol generally uses a 6 to 8 milligram. But if you use the pre-anesthetic, means diazepam, your midazolam, your butorphanol, your buprenorphine, your pentazocine, your acetaminophen, so these drugs which reduce the dose of this drug. So this reduce the dose, so definitely it reduces the ill effect of these drugs on the body. So ill effect is reduced by these drugs. Also for it's produce the smooth induction as well as the smooth recovery with the help of this pre-anesthetic drug. So number of the advantage for using of the pre-anesthetic drugs. So selection of the pre-anesthetic drugs so depend upon which type of the surgery you want to perform. Then duration of the procedures, means the length of the operations. So length of the surgical procedure is also considered for the selections of the pre-anesthetic drug. Then complications, which are some complication of some drugs is there. So it's depend upon the complications of these animal bodies. You can select these pre-anesthetic drugs. Then post-operative needs, some operations require the post-operative powerful analgesics. So particularly in orthopedic surgery, so you give the opioid drugs. Then age factor is also helpful for the selection of these drugs. Temperament of the animals is also helpful. So furious and docile animals. So depend upon the temperament, you can use the pre-anesthetic drugs. And finally, the physical condition of the animals. So it is a very important point. Physical conditions is a very important point. So obese animals, then lean animals, overweight animals. So these all are the factors are very helpful for the selection of the pre-anesthetic drugs. So all these points consider when you select the pre-anesthetic drug. So before the administration of this drug, so pre-anesthetic evaluations is very important. So we discuss in the next slide. So following pre-anesthetics, so only the trained pre-anesthetics are most commonly used in the veterinary practice. So number of the pre-anesthetic drugs is there, but out of these drugs, only the trained drug is generally available. You are used in the veterinary practice. So atropine and glycopyrrole is a anticholinergic drug. Then xylazine and dexmedetomidine is a sedative drug. Triflupromazine, everybody know about this drug. And acifpromazine is also new drug as a phenothiazine derivative. This drug is generally not easily available in India, but this drug is most commonly available in abroad conditions and most commonly used. This is the most commonly used pre-anesthetic drugs in canine practice. So some disadvantage of this drugs, particularly notice the penile prolapse in horses. This effect is dose dependent, means permanent and temporary type of the penile prolapse is noticed. It is totally the dose dependence effect. And benzodiazepams, benzodiazepam group is diazepam, midazolam. This is most common used drugs in canines, is easily available in the Indian markets. And opioids, there are long list of the opioids, but only the butorphenols, the pentazocine and buprenorphine. So these are the opioid, these are the group of the narcotic drugs. So out of this long list of this pre-anesthetic, but this 10 drugs is most commonly used in our veterinary practice. Before the administration of any anesthetic agent, first perform two pre-anesthetic evaluations. So pre-anesthetic evaluation must be performed before the administration of any drug. So it is a very important slide for how to evaluate the animals and how to prepare the animal for the administration of the drug and how to evaluate the animals. So pre-anesthetic evaluations will be performed by obtaining the pre-operative history and regarding journals and physicals, the status of the animals, and biochemical analysis of the animals. So through proper the patient evaluations and preparations will helpful for the improving the patient safety and ensure the successful anesthetic outcome. So pre-anesthetic evaluations has great influence on the dose and choice of the anesthetic agent and also the anesthetic, the technique. First evaluation is the point is the history, starting from the history. So durations and illness of the determine the which type of the anesthetic is required. So duration and nature of the illness is determine the duration and type of the anesthetic requirement. So patient with the renal and hepatic failures, means affected with the renal and hepatic affections, require the close monitoring during the anesthesia. Means both the systems are compromised, so close monitoring must be required. So one person spare for such type of the patients. And prefer the general anesthesia. So such patients are not administer injectable anesthesia because it is risky procedure. So generally prefer the inhalation anesthesia. And patient with the history of the epilepsy should not be used the phenothiazine derivatives. So if your animal is some history of epilepsy, so generally not prefer the phenothiazine derivatives. Otherwise produce it decrease the thresholds of the epilepsies. The second one is the signal meant. So signals meant regarding the case, the records, then breed, then age, sex, means details about the animals. So detailed identifications about the animals. Even the duration of the illness will be recorded properly and will be properly recorded. So not possible to accidentally administration of the anesthetic drugs in wrong animals. So many times it has happened when misidentification of the animals, even the misidentification of the drugs. So wrong drug is administered in higher dose in other animals. So such type of the accidental, if you don't want, then you take the perfect history and perfectly mention it. Then third point is the feeding and watering. So feed withdrawal period is generally recommended at least for the 6 to 12 hours in canine patients. So minimum the 6 to 12 hour withdrawal of the food is followed, and water withdrawal period is recommended for the 6 hours in canines, even in the felines, particularly in the plant surgeries. If the animal owner is not follow, many times animal owner not follow the instruction of the clinicians. If you not follow the instructions of food and water withdrawal, then they increase the risk of the incidence of the vomisons after inductions of the anesthesia. And its recovery periods, during the recovery, many times so during recovery periods, and increase the risk of the tracheal aspirations. So it creates the problem. So this point first discussed with the animal's owner before the signature on consent form. So the proper means strictly follow the rules and regulations regarding the pre-anesthetic evaluations and preparations. So means give the instruction to the animal owner. So minimum the 6 to 12 hour food withdrawal period and 6 hour water withdrawal period. Generally in the neonatal, this is the same instructions not follow in the neonatal patients. So because of their high metabolic demand causes the possibility of the hypoglycemia. And the water withdrawal should not be limited in patients, particularly in the renal affected animals, means kidney affected animals, even during the high ambient environment and temperature. So particularly the water withdrawals is not follow in neonatal as well as in renal affected animals, even during the high means summer seasons. So in other seasons you can follow in the adult animals strictly. It reduces the chances of the vomisons and reduce the chances of the tracheal aspirations. Now come on the relative size of the patients. So anesthetic dose should be on the basis of the milligram per kg body weight. So the calculation of the anesthetic means loading of anesthesia totally depend upon the body weight. So the proper weight of the animals, no underweight, no overweight. So as far as possible to means give the exact idea regarding the weight of the animals. So proper weight of the animals. So it is not a laborious work. It is very easily do it in the animals, small animal practice. So small animals have the higher metabolic rate than large animals, large size. So hence the large dose of anesthesia is required in small animals because the BMR is high as compared to the large breeds. So particularly in Swiss and even the Pomeranians, even the pugs. So these are the small breeds. So BMR of this breed is very high. So dose is definitely the dose, BMR is high, the dose is higher. So it's quickly metabolized in the livers. So higher dose is required in the smaller breed as compared to the larger breed, particularly in Great Dane, Rottweilers, even the Boxers. So requires a lesser dose as compared to the small animals, small breeds. Next one point is the species. So species difference is play the vital role in anesthesia. That may prevent the use of certain drugs. So certain drugs cannot administration in certain species. So for example wise, the morphine is contraindicated in cat. So if you give the morphine in cat, so cat is excited. Cat is excited. So don't use this certain drugs in certain species. Then considering the breed of animals, so play the roles. So breed is play the very good role in anesthesia, and certain breed is very risky regarding the anesthesia. Example was brachycephalic breeds. So brachycephalic breed like the bulldogs and pug. Pug is famous for the all over the world due to the hutch. But these animals are extremely prone to the airway obstruction. It is very risky breed, very risky breed regarding the anesthesia. So first to, when the pug is come in your clinic for any surgical procedures, so first to fill the consent forms and aware the animal owner regarding the risk. So why this animal is more risky regarding the anesthesia? Certain anatomy is responsible for that. Which anatomy is responsible for that? So pug, the size of the mare is very small. So coma-safe mares. So the flow of the air is obstruct starting from the mare. This coma-safe, small narrow opening is there. These are the first point. The second point is the track of the neck is a short neck. So length is very short. So the volumes, the tidal volumes means the volume of the air is less, means reserve volume is less in pug, because the short neck, then elongated, third point is elongated soft palate. So when you give the any anesthetic drug, so relax this elongated soft palate. So it's means relax, due to the relaxation is close the opening of the trachea. So the airway obstruction is most commonly seen in the pug. So how to reduce the risk of the anesthesia in this, because this breed is routinely coming in your clinics. So you don't away from this breed. So how to reduce the risk of anesthesia in this breed? Very easily reduce the risk in this breed. So we are routinely perform the operation in pug. So cataract in corneal related surgery, means the deep ulcers, your superficial ulcers, many times the grafting is there. So generally the most common requires the general anesthesia in this cases. So reduce the risk of anesthesia by the rapid inductions. So the quickly you induce the drugs, then rapidly endotracheal intubations. Endotracheal intubation is must be performed in brachycephalic breeds. So rapidly intubations, not slowly you perform the endotracheal intubations. So once you give the induction dose, induce the animals, then rapidly you introduce the endotracheal tubes and the quick supply of the oxygen. So this 3 point is very important for reducing the risk of the anesthesia in these breeds. Very easily you can manage it, not any mortality noticed in your clinics. So since the 10 years, I have performed a lot of the operations in this species, but hardly the 2 animals that died due to the anesthesia. The rate is very less as compared to the real data of the US. So in the US, so 10,000 animals performed for the surgical intervention, means the 10,000 animals anesthetized, and out of these 10,000, so 648 animals died due to the anesthesia. So as compared to the US, our data is very less. So I am happy. So second one is the greyhounds. So these breeds show the prolonged recovery periods. So when you're using thiopentone anesthesia, because you decrease the body fat. So it is greyhound is a lean animal. So if you give the thiopentone in this species, so recovery period is higher. So this is a breed, these are the breed specific some points. So evolution is very important. So general shepherds, the boxers, Great Danes have increased the sensitivity of the central nervous system depression. But generally, don't worry about this species. But these 2 species is very important, and particularly brachycephalic breed is more prone to the airway obstructions. So this point considers. So now the next one is the age factor. So anesthesia in very young animals is subjected with the higher risk. In the young animals is with the higher risk due to the limited size, limited musculature, limited adipose tissue. These are the helpful for the metabolize and excretion mechanism. Generally, these are the systems are underdeveloped in the young animals. So that's why. So generally in the young animals, so injectable anesthesia is not preferred. Generally, they prefer the inhalation anesthesia. So they particularly neonatals generally metabolize and excrete drugs less efficiently than adults. So generally prefer the inhalation anesthesia as compared to the injectable. Then old patients have a decreased anesthetic requirements, so less amount of the anesthesia is required. So this point is also kept. So animal is a neonate, your animal is old, your animal is adult. So on the basis of these three types, you can increase your dose, you decrease your dose, your optimum dose. So slow meta in old patients, in the aged animals, so slowly metabolize it and slowly excretate it, so with the prolonged effect. So less dose is required. So in this species, the patients, old patients, so generally prefer the inhalations and safer for the inhalations anesthesia. And finally consider the sex of animals, so sex factor. In males, so BMR is higher, approximately 7% is higher than females. So male is required the higher amount of the anesthesia as compared to the female. But in pregnant females, the BMR is higher due to the pregnancy, due to the activity of the metabolic activity of the fetus. So they require the higher dose as compared to the non-pregnant female, as compared to the non-pregnant female. But male is generally require higher, and in females animals, particularly pregnant female animals, require the higher dose because the BMR is higher due to the fetal activities. So physical status of the animal. So this is a funny slide. The physical status of the animals is determined by the body scoring scale of the animals, and identify the either animal is obese, overweight, underweight, or lean animals. So on the basis of this body scoring, so you can decide the dose of the, and means grading of the risk regarding factor. So obese animals have the lower BMR per unit of the body weight and need the less anesthetic than the lean, the musculature animals in the good condition. So now come on the general status of the animals. So general status of the animals will be evaluated by the clinical and laboratory examination of the animals. So this evaluations generally performed at OPD level. So first to clinical examinations of the animals by the recordings of the rectal temperature, then heart rate, then respiration rate, the mucous membrane color, and capillary refilling time. So give the better idea regarding the health status of the animals. So on the basis of this health status reports, so you can choose the animal is fit for the anesthesia, your animal fit for the surgery, your animal is unfit for the surgery, or animal is unfit for the anesthesia. So these decisions is generally on the basis of the clinical examinations and laboratory examinations. So if needed, the auscultation of the heart and lungs to note any unusual characteristics, and according to that you take the decision. So not each and every animal come for the surgical interventions, perform the laboratory examination. But if there any doubt regarding the health status of the animals, it will depend upon the choice of the clinician. So following test, laboratory test provide the basic information regarding the fluid balance status, then hepatic and renal the function test, the nutritional status of the animals, and even the oxygen carrying capacity of the animals. So if you give the injectable or inhalation anesthesia, so oxygen carrying capacity is very important. So in the anemic patients, generally not recommended the inhalation anesthesia. Now last point is the fluid and electrolyte balance. So on the basis of the clinical and laboratory test to determine the dehydration status of the animals and the correct dehydration condition of the patients using the isotonic saline solution. So first to stabilize the patients, and after the complete stabilization of the patients, the correct dehydration, then you give the administration of the any anesthetic drug. So before the administration of the any anesthetic drug, stabilization is must be considered in pre-anesthetic evaluations. So now come on the general status of the animals. So general status of the animal will be evaluated by the clinical and laboratory examination of the animals. So this evaluations generally performed at a OPD level. So first to clinical examinations of the animals by the recordings of the rectal temperature, then heart rate, then respiration rate, the mucous membrane color, and capillary refilling time. So give the better idea regarding the health status of the animals. So on the basis of this health status reports, so you can choose the animal is fit for the anesthesia, your animal fit for the surgery, your animal is unfit for the surgery, or animal is unfit for the anesthesia. So this decisions is generally on the basis of the clinical examinations and laboratory examinations. So if needed, the auscultation of the heart and lungs to note any unusual characteristics, and according that you take the decision. So not each and every animal come for the surgical interventions perform the laboratory examination, but if there any doubt regarding the health status of the animals, it will depend upon the choice of the clinician. So following test, laboratory test provide the basic information regarding the fluid balance status, then hepatic and renal the function test, the nutritional status of the. Now come on the second phase of the anesthesia is the induction of the anesthesia. So what is the induction of anesthesia? It is referred to achieve the state of the conscious to the unconsciousness by using the injectable anesthetic agents, and followed by with the perform the endotracheal intubation to the animal. So to the aims of the induction anesthesia, the one is to convert the conscious to the unconsciousness. So animal is convert conscious to the unconsciousness by using these drugs. And second one, after the complete desired the depth of the anesthesia, then you perform the endotracheal intubations for the easing the passage of the oxygen, even if the animal is connected with the inhalation anesthetic machine. So the means the passage of the oxygen with the inhalation anesthetic drugs. So endotracheal is generally performed for the safety of the patient. So this stage is against the subdivides into the four stages described below as the stage 1 is a voluntary movement, stage 2 is involuntary movement, stage 3 is a stage of the surgical anesthesia, and stage 4 is a progressive medullary paralysis. Means if you give the overdose, then animals enter into the overdose. So our aim to don't reach to the stage 4. Don't reach to the stage 4. Stop up to the stage 3, means the stage of the surgical anesthesia. So no need the detailed discussions about this, what is this different stage. You know very well, we already learned in the UG and PG levels. So how to achieve the induction anesthesia? So induction anesthesia is achieved by inducing the single bolus dose of the injectable general anesthesia using the ketamine, your thiopentone, your propofol, your etomidine, your alpha-zalones. So ketamines, through the ketamines, xylazine, your ketamine diazepam is most commonly used drug in the field condition, but I will give some detail about the thiopentones and propofol. This is the most widely used induction agents in the canine all over the world. So these two drugs are the short-term intravenous induction agent and attain the popularity all over the world. So everybody, this drug is used nowadays in the world. But some more drugs is also enter in our field, etomidine and alpha-zalones. So these two drugs are nowadays very costly, and this drug is generally safe for the cardiac and unstable, hemodynamic unstable patients. So if any patient is hemodynamically unstable, even the cardiac patients, suppose you want to perform the surgery, so these are two drugs, these are the latest drugs. This is the latest drugs. So etomidine and alprazolam is the most commonly used in the human beings, particularly in cardiac surgery. In this webinar, I cover the two, mainly the short-acting induction agents. One is thiopentone and another is a propofol, and also give some brief information regarding the ketamine. Ketamine is the most famous, and everybody use these drugs and aware about this drug. So first is a thiopentone. So thiopentone is the ultra short-acting barbiturate anesthetic drugs available in the 0.5 grams and 1 gram vial in the dry powder form. So what do you mean by the ultra short acting drugs? So ultra short acting drugs means after administration of this drug as a form of the anesthesia, as a form of the induction anesthesia, to produce the short duration of the anesthetic period, short duration of the action. So within the 10 to 15 minutes, the finish your work. So within 10 to 15 minutes, you perform the intrathecal intubations, and finally animal shift in the maintenance anesthesia. So duration of the thiopentone is very short, generally 10 to 15 minutes is the maximum 15 minutes work duration. So thiopentone having the rapid inductions, so these are the advantages of this thiopentone. Is very good muscle relaxations, work as an anticonvulsant drug because it forms a barbiturate group of the anesthesia as a work as an anticonvulsant drugs. But having some disadvantage of this drug means it is having the no analgesic property. So thiopentone is always preferred used with the premedication. So generally the opioid is add with the thiopentones, so to avoid the complications during the general anesthesia and recovery. So particularly in stayings and orthopedic surgery, so thiopentone is very good induction agent. It gives the better muscle relaxations with the diazepam, your midazolam. So if you give the diazepam with thiopentone or midazolam with the thiopentone, so powerful muscle relaxations is as noticed. In staying is also very easily performed under these combinations. Generally 1.25 or 2.5% freshly prepared solutions is used in the canine practice. So how to prepare these solutions, 2.5% freshly prepared solutions? So these solutions is generally the prepare using the distilled water or normal salines. So these solutions never prepare in dextrose solutions because it produces the glucose effects, means the re-anesthetize the patient. So always add the distilled water or normal saline, but don't add the dextrose. So no entry of the NS in OT. So in our OT, generally the NS is available. No DNS, no dextrose is allowed inside the OT. So it's produce the glucose. Means once you add this glucose as a form of the dextrose, so infuse it, so chances of the animal re-anesthetize. So these are the glucose effect. Then how to prepare this 2.5% solutions? So 2 vial 0.5 and 1 gram vial is available in the market. Suppose you want to prepare the 2.5% solutions from the 0.5 gram vial. So 2.5% solutions meaning, what is the meaning of this 2.5% solution? So very simple meaning. So 25 milligram concentration of the thiopentone in 1 ml of the solution. So simple meaning 2.5 means 25 milligram in 1 ml. So in 1.5 gram of thiopentone vial, add the 20 ml of the distilled water. Now add the 20 ml of the NS and mix it. This makes the 2.5% solutions. And for preparation of the 2.5 from the 1 gram of the thiopentone vial, add the 40 ml of the distilled water. But in 1 gram vial, not possible to add the 40 ml distilled water, or 40 ml NS. So how to prepare the 2.5? So first to add the 20 ml of the distilled water and make the 5% solutions. So at the time of the induction of the dose, the half of the 5% solutions of the thiopentone load in the syringe, and same quantity of the distilled water is again add it and dilute it and make the 2.5% solutions. So very easy. So first to make the 5% solutions, and when you use it at the time of using, so load the solutions half, and half quantities again add the distilled water, so automatically make the 2.5%. So this preparation of this 2.5% is from the 0.5 gram and 1 gram. So one more important I want to discuss here. So literature suggests freshly prepared solution should be used. Always freshly prepared solution should be used. This is the theoretical point kept here. And after use, the remaining solution should be discarded. This is line of the theory. But practical experience is different. So I want to share it with you. So after newly preparation of the solutions, the first after the preparation of the 2.5% solution from 0.5 gram or means 1 gram, the vial adding the distilled water as per the percentage. So after the preparation of the solutions, the first write down the date and percentage in the vial of the thiopentone. So first write down the date of these preparations and the percentage, how much percentage of the solutions. And after using the solution, first freshly prepared solution, you use it, and after using these remaining solutions is don't discard. The solutions is aseptically sealed with the using the medical adhesive tape. So on the top of this vial is apply the antiseptic solutions, especially the spirit, and then trap it. Medical tape is applied around this vial, and this vial is kept inside the refrigerator in normal temperatures, in normal refrigerator temperature. It will be reused up to the this solution is used up to the no any precipitation visible in the vials. So at each and every time, whenever use these solutions at the reuse, so first to check the precipitations. So if any precipitations are visible inside the vial, so discard it. Discard this. So the first to check, before use the first to check. If any preparation, then discard it. So if no any precipitations, so no need to discard it and continue use it. And if you found any precipitation, then discard it and prepare the new solutions, and again start use with this manner discuss here. So generally we are using the more than 1 week old solutions, more than 1 week old solutions. So practical experience is different from the theoretical approach. So without loss of any efficiency of these drugs and without any complications, no any complications, the notice or found regarding the reuse of this thiopentone. So I give the advice to the persons, those who discard these solutions, don't discard it. So take that aseptically and load it, and then apply the antiseptic solutions, means spirits, then apply the medical step, reuse. So reduce the cost of the drugs. So one more important I want to discuss here. So literature suggests freshly prepared solution should be used. Always freshly prepared solution should be used. This is the theoretical point kept here. And after use, the remaining solution should be discarded. This is line of the theory. But practical experience is different. So I want to share it with you. So after newly preparation of the solutions, the first after the preparation of the 2.5% solution from 5 gram or means 1 gram the vial, adding the distilled water as per the percentage. So after the preparation of the solutions, the first write down the date and percentage in the vial of the thiopentone. So first write down the date of these preparations and the percentage, how much percentage of the solutions. And after using the solution, freshly prepared solution, you use it. And after using these remaining solutions, don't discard. The solutions is aseptically sealed with the using the medical adhesive tape. So on the top of this vial is apply the antiseptic solutions, especially the spirit, and then trap it. Medical tape is applied around this vial, and this vial is kept inside the refrigerator in normal temperature, in normal refrigerator temperature. It will be reused up to the this solution is used up to the no any precipitation visible in the vials. So at each and every time, whenever use these solutions at the reuse, so first to check the precipitations. So if any precipitations are visible inside the vial, so discard it. Discard this. So the first to check, before use the first to check. If any preparation, then discard it. So if no any precipitations, so no need to discard it and continue use it. And if you found any precipitation, then discard it and prepare the new solutions. And again start use with this manner discussed here. So generally we are using the more than 1 week old solutions, more than 1 week old solutions. So practical experience is different from the theoretical approach. So without loss of any efficiency of these drugs and without any complications, no any complications, the notice or found regarding the reuse of this thiopentone. So I give the advice to the persons, those who discard these solutions, don't discard it. So take the aseptically load it and then apply the antiseptic solutions, means spirits, then apply the medical step, reuse. So reduce the cost of the drugs. So one more important I want to discuss here. So literature suggests freshly prepared solutions should be used. Always freshly prepared solutions should be used. This is the theoretical point kept here. And after use, the remaining solution should be discarded. This is line of the theory. But practical experience is different. So I want to share it with you. So after newly preparation of the solutions, the first after the preparation of the 2.5% solution from 0.5 gram or means 1 gram the vial, adding the distilled water as per the percentage. So after the preparation of the solutions, the first write down the date and percentage in the vial of the thiopentone. So first write down the date of these preparations and the percentage, how much percentage of the solutions. And after using the solution, freshly prepared solution, you use it. And after using these remaining solutions, don't discard. The solutions is aseptically sealed with the using the medical adhesive tape. So on the top of this vial is apply the antiseptic solutions, especially the spirit, and then trap it. Medical tape is applied around this vial, and this vial is kept inside the refrigerator in normal temperature, in normal refrigerator temperature. It will be reused up to the this solution is used up to the no any precipitation visible in the vials. So at each and every time, whenever use these solutions at the reuse, so first to check the precipitations. So if any precipitations are visible inside the vial, so discard it. Discard this. So the first to check, before use the first to check. If any preparation, then discard it. So if no any precipitations, so no need to discard it and continue use it. And if you found any precipitation, then discard it and prepare the new solutions. And again start use with this manner discussed here. So generally we are using the more than 1 week old solutions, more than 1 week old solutions. So practical the experience is different from the theoretical approach. So without loss of any efficiency of these drugs and without any complications, the notice or found regarding the reuse of this thiopentone. So I give the advice to the persons, those who discard these solutions, don't discard it. So take the aseptically and load it and then apply the antiseptic solutions, means spirits, then apply the medical step, reuse, so reduce the cost of the drugs. So one more important I want to discuss here. So literature suggests freshly prepared solutions should be used. Always freshly prepared solutions should be used. This is the theoretical point kept here. And after use, the remaining solution should be discarded. This is line of the theory. But practical experience is different. So I want to share it with you. So after newly preparation of the solutions, the first after the preparation of the 2.5% solution from 0.5 gram or means 1 gram, the vial, adding the distilled water as per the percentage. So after the preparation of the solutions, the first write down the date and percentage in the vial of the thiopentone. So first write down the date of these preparations and the percentage, how much percentage of the solutions. And after using the solution, first freshly prepared solution, you use it, and after using these remaining solutions is don't discard. The solutions is aseptically sealed with the using the medical adhesive tape. So on the top of this vial is apply the antiseptic solutions, especially the spirit, and then trap it. Medical tape is applied around this vial, and this vial is kept inside the refrigerator in normal temperatures, in normal refrigerator temperature. It will be reused up to the this solution is used up to the no any precipitation visible in the vials. So at each and every time, whenever use these solutions at the reuse, so first to check the precipitations. So if any precipitations are visible inside the vial, so discard it. Discard this. So the first to check, before use the first to check. If any preparation, then discard it. So if no any precipitations, so no need to discard it and continue use it. And if you found any precipitation, then discard it and prepare the new solutions, and again to start use with this manner discuss here. So generally we are using the more than 1 week old solutions, more than 1 week old solutions. So practical the experience is different from the theoretical approach. So without loss of any efficiency of these drugs and without any complications, the notice or found regarding the reuse of this thiopentone. So I give the advice to the persons, those who discard these solutions, don't discard it. So take the aseptically and load it and then apply the antiseptic solutions, means spirits, then apply the medical step, reuse, so reduce the cost of the drugs. So one more important, administration of the thiopentone as an induction is a skill, and how to achieve the till the effect. So these 2 points discussed here. One is how to administer these drugs, not just like ketamine, and how to achieve the till the effect. So I will discuss in this slide how to achieve the till the effect. The first 1/3 dose of the total calculated dose of the thiopentone. So total calculated dose, out of this total calculated, first you give the 1/3 dose of the thiopentone intravenously within the 5 to 10 seconds. Within 5 to 10 seconds. So give the within 5 to 10 seconds. Then remaining solution for administration of remaining solution wait for. Then wait for few seconds to minutes and observe the respiratory pattern of the animals. So during this stage of the administration, the many times animals show the slow and irregular respirations or stop the respirations. It means the animals show the induction apnea. So this is a complication of the barbiturative anesthesia, and wait and correct these complications by the administration of the oxygen therapy. So sometimes the induction apnea up to the 1 to 2 minutes observes prolonged duration of the induction apnea. So if you notice any induction apnea, so immediately administration of the oxygen through the umbu bags with the help of the umbu bags. So the correct the condition of the animals, recover the animals. If you proper time, so take the decisions. If animal is not show the sign of induction apnea after administration of the 1/3 dose, then relax it. Then the followed by the continuous intermediate dose of the thiopentone. So remaining dose is give slowly up to the abolize the pedal reflex, up to the abolize the pedal reflex. So induction apnea is generally noticed in rapid administration. If you give the rapid administrations, so animal they show the sign of the induction. Not each and every time show the induction apnea, but possibility when you give the rapid inductions, rapid administration of this drug, so chances of the induction apnea. So how to reduce this complication? So advised to give the slow administration of this drug and reduce the risk of the induction apnea. My dear friends, I am honestly say to you, since the 7-8 years, regularly use this drug for canine practice regularly. But till date, I have never found the induction apnea in any animals. I am really honestly say, so no found any induction apnea. If your technique is correct, your administration skill is correct, so no chances of the induction apnea. So once this complications is reduce it, so save your animals for thiopentone. And surely say to improve your skill in thiopentone and propofol administrations, so no any casualty due to the anesthesia. Then deviation of the eyeballs is not a good indicator for the determination of the depth of the anesthesia. Many times the deviation of the eyeballs definitely give the idea about the depth of the anesthesia. But my point regarding the abolize the pedal reflex. Getting my point? So up to the at which level to administer drugs, not downward deviation. Many times the clinicians eyeball is downward and deviation, stop the administration of thiopentone. So after the few, thiopentone is finally the ultra-protecting drug. So if you give the not achieve the sufficient effect, then after the few minutes you cannot perform easily undertaking intubations. Against animal is walk it, and again the animal is conscious it, again you give the further dose. So what is the exact administration levels? So it is administered, so prefer the pedal reflex. So pedal reflex is indicate the pain reflex, analgesic characteristic of the general anesthesia. So how to check it? Check by the pinch the interdigital skin with the help of not a thumb and index finger. So with the help of thumb and index finger, you cannot determine the pain reflex in animals, particularly in dog. So you use the Alice forceps. So pinch with the help of this Alice forceps. If underdose, animals show the pain. Means withdrawal of the limbs in upward direction. So this upward direction withdrawal of the limbs many times, so it's quick response, many times in means the sluggish response means slow response. Sluggish response means slow response, and many times so no any reflex means completely abolize the pedal reflex. So thiopentone is administered slowly up to the pedal reflex is abolished. So once the pedal reflex is abolished, all the reflex are at that time abolished. So corneas, palpables, then complete downward deviation of the eyeballs, jaw tones is relaxed. So means all the reflex is abolished, means animal enter into the general anesthesia. This is basic characteristic of the general anesthesia. So improve your skills to check the pedal reflex. So this is a till the effect. This is the meaning of the till the effect. Means give the administration of the drugs to the till the effect. जब तक उसकी इफेक्ट नहीं आए तब तक उसको आपको एडमिनिस्ट्रेशन करते रहना पड़ेगा, तब तक उसको देते रहना पड़ेगा. और वो भी कैसे देना है? स्लोली, क्विक से नहीं कूद जाना उसमें, पूरा डोज नहीं दे देना है, थोड़ा करके दे, तो उससे उसका डोज भी कम होता है. जनरली 10 मिलीग्राम के हिसाब से लिया है तो है जरूर नहीं है कि वो 10 का 10 पूरा जाए. वो 8 में भी पूरा हो सकता है, 6 में भी पूरा हो सकता है, 5 में भी हो सकता है. 5 तो लेगा ही, 5 या तो 5 से ऊपर तो लेगा ही, मगर 10 से कम लेगा वो भी श्योर है. नेक्स्ट एजेंट इज प्रोपोफॉल. सो प्रोपोफॉल इज also short rapid acting intravenous inductions as well as the maintenance anesthetic agent. So propofol is not only used for the induction of the anesthesia, this drug is also used for the maintenance anesthetic agent. So induction as well as the maintenance, the property present in the propofol. So propofol is having the minimum cardiovascular depression, so minimum effect on cardiovascular systems, having the no analgesic property. This drug does not, one more advantage, these drugs cannot cross the placental barrier. So this drug is recommended for the cesarean sections in which, but disadvantage of these drugs, similar like some disadvantage is there, like same like the barbiturate, means produce the inductions, apnea and hypotension. So animal affected with the hypertension, so don't use these drugs. So this drug is also produce the hypotension, so chances of the collapse of the animals. So propofol is available in the milky white aqueous solutions, available in the 10 ml and 20 ml. The sterile vials that contain the no preservatives, no any preservative present inside the propofol. So which no preservative means it supports the microbial growth and endotoxin productions, and therefore the vial should not be used on next day once it's open. So these are the guideline of the theory. This is a guideline of the theory. Once you open it, then on the next day, after overnight, the next day you cannot use, because the chances of the microbial growth and endotoxin production. But this drug is also reused in our department. This drug is also reused as the same patterns, the follow like the thiopentone, without any effect. So after withdraw with the disposable syringe, every time use the disposable syringe and needles. Don't contaminated syringe and needle you introduce. So each and every time, whenever you introduce the needle, so use the disposables, then discard it. So introduce needles, then withdraw the drugs, then apply the spirits as antiseptics, and apply the medical adhesive tape. Kept in refrigerator for the normal temperature. Again the next day, so you can use very easily. So reuse it. So reduce the cost of these drugs without any ill effect. Same patterns like thiopentone. So next one is the ketamines. So ketamine is the most commonly used dissociative type of the anesthetic agents in canine practice. Everybody know about these drugs having the poor muscle relaxations and no analgesic property, produce the tremor when giving the alone, eye remain open, no abolize the laryngeal reflex, no abolish the pharyngeal reflex, no abolize the swallowing reflex. These are the common complications and common the property noticed by the ketamine. So this drug generally not recommended use as a sole agent. So this drug single agent not recommended in any species except cat. So in cat generally you can use this drug as a sole agent and give the good results. But if you give with the xylazine, it gives the better results. But generally in other species not, particularly in equine is not recommended alone this drug, otherwise it produces the cataleptic effect. So severe tremor is produced, means no analgesic property, no muscle relaxation properties. So this drug is always recommended, means always used with the sedative or tranquilizer drugs. So with the xylazines, or with the diazepam, or with the midazolam. So these common combinations, diazepams, ketamine, and xylazine ketamine. So you all are the routinely used in your practice. So generally the safe and short duration procedures is performed without uneven full recovery is also noticed. So maintained by the repeated induction bolus dose. But some side effect of this drug is there. So it will increase the heart rate, increase the cardiac output, increase the blood pressure. So that's why this drug is not commonly recommended or commonly used in the ocular and neurosurgery, when head region surgery. Otherwise, it increase the intraocular pressures in the ophthalmic surgery, and in neurosurgery increase the intracranial pressures. Even in the hyper blood pressures, patients not recommended these drugs. The third phase is the maintenance of the anesthesia. So what is the meaning of the maintenance of the anesthesia? It is referred to the prolongation of the anesthesia. Means the increase the duration of the anesthesia, and during this stage perform the surgical interventions. So complete the unconsciousness, means powerful the muscle relaxations and powerful strong analgesic effect required during the surgical intervention. So these are the basic need of the general anesthesia. So the prolongation of the anesthesia are achieved by the administration of the either injectable drugs using the propofol as a CRI or as a repeated dose, or as an inhalation agent using the halothane, isoflurane, sevoflurane, and dextrose. So halothane is now outdated in India. Now India is shift in the isoflurane, and the world is shift on sevoflurane and dextrose. So isoflurane is new for India, but some institute is also used with sevoflurane. But now the halothane is outdated. So those who are persons interested for purchasing the inhalation anesthesia, don't purchase the halothane containing the inhalation anesthetic machine. So now the isoflurane means purchase the isoflurane having the inhalation anesthetic machine. So this stage provides the desired depth of the anesthesia, and the animal can tolerate the surgery without any resistance. So these are the basic need of the maintenance anesthesia, and you can perform the surgery, surgeon can perform the surgery without any disturbance, and that's why therefore this stage is also called as surgical anesthesia, stage 3, surgical anesthesia, because animal cannot tolerate the surgery without any resistance. Means powerful depth of the anesthesia. Last phase is a recovery phase. So it is referred to the gradual revival of the animals from anesthetic stage to the normalcy. So animal become normal. So it is a critical stage of the anesthesia, and this phase will start after the cessation of the general anesthesia. So after the stoppage of the general anesthesia, and end at the animal show the complete consciousness. So proper selection of the anesthetic agent and technique may also reduce the recovery period. So in inhalations and the propofol CRI, generally the animal recover within the 20 minutes, means 10 to 20 minutes time is sufficient for recovery. So most of the animals recover during this period. So head is raised, reflexes is shown the animals. So this is a sign of the recovery. And when the sign is so, you discard the animals, discharge the animal from the hospital without worry. Concept of the general anesthesia means what is the general anesthesia? So general anesthesia means the state of the controls and reversible, the loss of the consciousness in association with the muscle relaxations, amnesias, and analgesia. So these are the three basic properties of the general anesthesia. So general anesthesia is one of the miracle of the veterinary medicines, having the following the properties, means characteristics, with following characteristics. Concept of the general anesthesia means what is the general anesthesia. So however, all these characteristics like unconsciousness, then muscle relaxations and analgesia, so all these characteristics cannot be provided by the sole agent, but it can be possible by the balance anesthesia. It can be possible by the balance anesthesia. So no any single agent to fulfill this all the requirements. So this slide shows no single agent can fulfill this all requirement. Example, ketamine is produce no consciousness, no muscle relaxation. Thiopentone produce only consciousness and muscle relaxation but no analgesia. And propofol produce the unconsciousness but no muscle relaxation and no analgesic property. No any single agent produced all these characteristics. So how to produce this all the characteristics? With the help of the balance anesthesia. So nowadays the concept of balance anesthesia is come in the field of the anesthesia. In the recent year, the concept of the balance anesthesia using the combinations of various preanesthetics and general anesthetics have entered in the veterinary anesthesia rather than the use of the single anesthetic drugs for the major surgical interventions. So balance anesthesia means combination of the two or more than two drugs. Means two or more than two drugs is used for the major surgical interventions. So these are the new concepts regarding the balance anesthesia. So number of the advantages of this ideal balance anesthesia, it's provide the smooth rapid inductions, adequate hypnosis, then proper analgesia and uncomplicated recovery with the minimum suppression of the vital organ functions and adverse effects. So these are the advantages of the balance anesthesia. So how to achieve this all the advantage? So this all the advantage is achieved by using the balance anesthesia in our canine practice. Now come on how to achieve the balance anesthesia in canine. So this can be achieved by using the following combination of the drugs and techniques. So using as atropine or glycopyrrolate as an anticholinergic agent depend upon the requirement of the clinicians and choice of the surgeries, and then butorphanol, pentazocine or buprenorphine uses as an opioid drugs, then diazepam or midazolam or aspirin used as a tranquilizer drugs, then xylazine or dexmedetomidine used as a sedative drugs. Thiopentone, your propofol used as an induction agent, short acting, and propofol used as a CRI or isoflurane used as a maintenance anesthesia in canines. So combination of the two or more drugs using perform the major surgical interventions, two or more drugs. When you combine the two or more drugs, so this is the concept of the balanced anesthesia. Means it will balance the effect of other drugs. Balance the effect of other drugs. That's why it's called as balanced anesthesia. Balanced anesthesia. So here the mention the 4 balanced anesthetic protocols in the box. So using the different pre-anesthetic and general anesthetic drugs for better understanding and improving of administration skill of the anesthetic drugs. So I want to demonstrate one balanced anesthetic protocol using the propofol as a CRI out of this 4 balanced anesthetic protocol. So one protocol selected for the as a form of the procedures. Before the starting of any anesthetic procedure, means any administration of the anesthetic drugs, the first step is to start with the assemble of the materials. Means required material is first to assemble it. First to check the list of the required materials and items, and one by one assemble it in the following order. So first start with the syringe and needles. So syringe and needle used for the loading of this anesthetic drugs. Then IV scalp veins, medical tape or IV cannula with the fixator used for the patency of the IV lines. Then cotton strings used for the holding of the upper and lower jaw. Then kidney tray used for the holding of the loaded drugs and other instruments. Then thermometer used for the measuring of the temperatures, the pre, during and post anesthetic periods. And Alice forceps is used for the checking of the pedal reflex. So this slide shows the CRI assembly, and start with the 3-way connector, 1 number. Then IV set 2 numbers, means 2 set is required. Then IV stand, 1 IV stand is required. Then 100 ml bottle as per the durations of the anesthetic period, and 500 ml the NS bottle. So 2 type of the bottle is required, one for the CRI and other for the administration of the fluids. If the person is affordable for the continuous infusion of this drug, so this 2 instrument is helpful for the administration of the drugs as a constant rate. So syringe infusion pump and your IV set infusion pump. So cost is a syringe infusion pump cost is a 20,000 rupees, and IV set infusions the cost is more than 50,000 rupees. So this 2 instrument is nowadays available in the market for the administration of the continuous infusion of these drugs. So laryngoscope is a handheld instrument used for the better visualization of the larynx and other nearly structure of the oral cavity. It most commonly used to facilitate the endotracheal intubations. So there are the 2 types of the laryngoscope available in the market. One is a McIntosh and another is a Miller. So Miller is the most commonly used laryngoscope in veterinary practice, and this instrument available at a very low cost. So 1200 rupees cost of the laryngoscope. It's easily available in the humans, the pharmaceutical, the market. So this instrument is very useful for the facilities, the introduction means intubation of the endotracheal tubes, and different type of the blades and with the lamps is available with the handles. So this instrument, if you're not having this instrument in your clinic, so don't worry about it. So pen light, torch pen light is also useful for the administration of the endotracheal tubes. Even the mobile light is also useful for the administration of the endotracheal tube. So proper visualization is our aim. For means the laryngeal regions visualization is our aim. So in market the tongue replacer is hardly the 30 rupees the cost of this instrument. So the tongue replacer is helpful for the suppression of the epiglottics. So to suppress the epiglottics, so the clear the visualizations of the inner tube means the trachea, the lumen of the trachea very easily so visible when you press the epiglottics with the help of the tongue replacer. So tongue replacer hardly 30 rupees cost, available very easily in human pharmaceutical market. Next one is a endotracheal tube. So endotracheal tube is required for the safe and proper delivery of the oxygen and inhaled anesthetic gas. So size of the ET tubes, the commonly referred on the basis of the inner diameter of the tubes and measuring in the millimeter. So generally 3 to 9 number of the ET tubes is used in the canine anesthesia. So it is a basic requirement for reducing the risk of the anesthesia. And it is easily available in the easily available in the market. The cost is 80 to the 200 rupees, depend upon the number of the tubes. This is the esophageal stethoscope. It is a special type of the instrument used for the auscultation of the heart through the esophageal lumen. But normal stethoscope is also useful for the auscultation of the lung and heart. Press on the put on the thorax region. Pulse oximeter is a very important instrument for the measuring of the two systems, means the determination of the two systems, monitoring of the two systems. One is the cardiovascular system and other is the respiratory systems. So two parameters shown by this pulse oximeter. One is SpO2, means oxygen saturation at the end point, at the cellular layer, means how much amount of the oxygen is present at the end level of the tissues, is indicate the status of the respiratory system. And another is a pulse rate. So pulse rate is indicated the status of the cardiovascular system. If these two systems is correct, then don't worry about the other systems. So pulse oximeter is a very simple and it is an important pulmonary monitoring device and generally used for the measuring of the SpO2 and the pulse rate. The cost of this instrument is hardly the 3,000 rupees. 3,000 rupees is nothing in the canine practitioner. So Ambu bags is a manual resuscitator device, allow the controlled ventilator in patients with the ET tubes. With the ET tubes or without the ET tube, you can use it for the controlled ventilation. So Ambu bags valves always allow the patient to inhale the room air only. So this point kept in your mind, room air only is inhaled by the Ambu bags. So oxygen cylinder. So these are the two type of the oxygen cylinder available in the market. One is the E type, another is a H type, on the basis of the capacity of the gases. So type E means the small size of the cylinder, and type E means type H means the large type of the cylinder. So small size cylinder contains the 690 liter of the oxygen, while the large size cylinder contains the 6,990 liter of the oxygen. So those who are interested in purchasing, it's available on the deposition basis. So generally the 5,000 deposits and refilling charge is a 370 rupees for the large cylinder in Gujarat state. So this refilling charges I am mentioned here under the in Gujarat state. I don't know what are the exit charges in outside the Gujarat. So these are the pressure gauge, means calibrated pressure gauge with the valve is fixed on the top of the cylinder, oxygen cylinder, and it display the pressure of the oxygen in cylinder. So it's rotate anti-clockwise to open it, and clockwise, rotate the clockwise, it is a close it. So open and clock is anti-clockwise is open and clockwise it close it. So how much amount of the oxygen present inside the cylinder is displayed by this first dial. So this dial displays the pressure of the cylinder. So generally the full cylinder having the 2200 psi, the pressure means the 150 cm per kg square. So this is a unit of the Indians, and generally US prefer the psi. So full bottle having the 2200 psi, 2200 psi. So anesthesiologist should change the cylinder as soon as it reaches the 100 psi. If it reaches the 100 psi, means replace this bottle with the other new bottle. Otherwise, the chances of the hypoxia in animals. So in the next one, dial is a pressure regulator dial, means the pressure reducing valve. So convert the high pressure into the low pressures and allow the oxygen toward the patient is only 40 to 50 psi. Means the full bottle having the 222, the 100 psi. So this is a high pressure system. So our animals, even the human patient, even the canine patients cannot tolerate these pressures. So our lungs and animals' lungs tolerate only 40 to 50 psi. So with the help of this second dial, so fix it. So it indicates on B's. So fix is on 40 to 50 psi. And in the Indians, measuring unit generally is fixed in the 3.5 to in between the 4 kg per cm square. So high pressure gas within the cylinder is dangerous to the patient. It ruptures the lung tissue. So proper regulate it with the help of the pressure regulator. Now after the complete the preparations of the assemble of this all the material, then animal is prepares. Now prepare the animal for the anesthesia. First to take the signature on consent forms and inform the regarding the risk of the anesthesia and surgery. So never forget it. First to take the signature on consent forms and also inform the animal's owner regarding the risk. So mentally they prepare the animal's owner regarding the risk. Then confirm the animal's owner follow the instructions given by the clinicians properly regarding the food and water withdrawal in planned surgeries. So check it. First to check it. So animal should be fast for 24 hours and water withdrawal period for the 6 hours prior to the administration of the anesthesia. So first it check to confirm it. So after the consent signature on consent forms and check about the feeding history and water histories, then measuring the body weight of the animals. So here mentions the simple trick of the measuring of the body weight of the small pet using the digital balance device. So the body weight is very important because the loading of the dose is totally on the body weight. So no underweight, no overweight. So after measuring the weight of the animals, then as per the body weight, selected protocol as per the selected protocol to load the anesthetic drugs and as per the body weight. So ready-made charts is prepared and fix in your the OT, fix in your clinic. So no chances of the miscalculations. So no chances of the even also reduce the time of the calculations. Calculation of the drugs as per the body weight, then the loading of the anesthetic drugs in syringe and proper label it. So don't forget label it. So first to load it in as per the syringe, as per the volume, means select the syringe and then label it. Proper labeling is must be performed. Calculation of the drugs as per the body weight. So after loading of this anesthetic drugs and labeling, then next step is the selection of the suitable size of the endotracheal tubes. So how to select the endotracheal tubes? So on the basis of the following the formula. So this formula, so first you take the weight of the body weight, kept the weight of the body, suppose the animal weight is 10 kg, so 10 plus 15 divided by 4. So 25 divided by 4 means 6, more than 6 number the ET is selected for the 10 kg, the dog. Then next step is to determine the length of the ET tube. So how to determine the length of the ET tube? Through the measuring of the distance from the incisor to the thoracic inlet. So first to measure the length of the incisor to the thoracic inlet, and then mark on the, with the help of the marker, to mark this at the side of the incisor. So this length is only this length is enter inside the respiratory tract. So if you give the beyond these tubes, means reach the beyond this mark, so this tube is entering only in the one bronchus. So chances of the collapse of the other lungs. So reduce such type of the accidental damage. So first to determine the length of the endotracheal tubes. Now start the step of the administration of the anesthesia. The first step is a administration of the atropine sulfate and butorphanol as a pre-anesthetic drugs in dog. So first the atropine sulfate at the dose rate of the 0.02 mg per kg body weight, and butorphanol at the dose rate of the 0.2 mg per kg body weight intramuscularly, first administered in the dog. You can use the glycopyrrolate as an anticholinergic and buprenorphine or pentazocine as an opioid anesthetic drugs instead of the butorphanols. So after the administration of these two drugs, so atropine and glycopyrrolate, then wait for the 15 minutes without any further disturbance of the animal, and during this the periods only you can fix the intravenous catheter for the administration of the next drugs. So if you want to give the atropine and butorphanol by intravenous, so fix the intravenous catheter earlier in previous steps, so reduce the time of and this drug is also given as an intravenous route as well as the intramuscular route, but the intramuscular route is safe because the slow absorption of these drugs. So after the 15 minutes, so without any disturbance, only apply the intravenous, the catheter, fixation of the intravenous catheter, then throw this intravenous catheter. So diazepams can be administrations at the dose rate of the 0.5 mg per kg body weight intravenously. So after reach at the desired strength of the sedation, and start the next step of the anesthesia to induce the short acting induction anesthesia through intravenous and perform the endotracheal intubations. So 5 minutes after the intravenous administration of the diazepam, induction of the anesthesia can be achieved by the intravenous administration of the 1% propofol up to the till the effect. And similarly, you can use the 2.5% thiopentone up to the till the effect as an induction agent in the dog. So nowadays, etomidate is also used as an induction agent. Generally, this drug is used in the human cardiac patients and hemostatic unstable patient. So after the intravenous administration of the induction agent, and check the following reflexes like the jaw tones, eyeball positions and pedal reflex, which indicate the characteristic of the general anesthesia. So jaw tone indicates the muscle relaxations, eyeball positions, corner reflex and palpebral reflex indicate the depth of the anesthesia, and the pedal reflex indicate the pain status of the animal. After the complete abolize all the reflexes, then start the endotracheal intubations. So what is the endotracheal intubations? So endotracheal intubations is a passes of the tubes through the mouth into the trachea to maintain the airway patencies. So these are the very simple meaning of the endotracheal intubations. So after desired depth of the anesthesia, animal shift in the sternal or lateral recumbency with extended head and neck for endotracheal intubations. So shifting of the animals either sternal or lateral recumbency, it depends upon the choice of the clinicians and skill developed by the clinicians. So both the recumbencies generally prefer either sternal recumbency or lateral recumbency. Is totally depend upon the choice of the clinicians and skill of the clinicians. So after the shifting of the animals, either sternal or lateral recumbencies, then the retainer should fully extended the upper and lower jaw by using the cotton strings and pulling of the tongues towards the downward directions for the better visualization of the laryngeal regions. So does not push the neck of the animals in ventral direction, which obscure the laryngeal anatomies. So when you press in the ventral direction, means the chances of the disturb the anatomy of the larynx, you cannot visualize properly. So now endotracheal intubations is carried out after with the suitable size of the endotracheal tubes under the guidance of the laryngoscope or by the blind techniques. So some persons perform the blind techniques. So this skill is developed by such persons, so blindly to perform the endotracheal intubations without using the laryngoscopes. So following the successful endotracheal intubation, then you correct the placement of the endotracheal tubes can be confirmed. How to confirm this endotracheal tubes? Suppose the endotracheal tubes is entering inside the trachea, so show the mild coughing and passing of the expired air through these tubes. So these are the good indicators. The tube is inside the trachea. So animals show the mild cough in its initial stage. When you enter this tube inside the trachea, if the tube is inside, it means enter inside the trachea, so animals show the mild coughing and passes of the expired air through these tubes. That is very clearly visible. And finally ensure that tube enter the trachea and not into the esophagus. So this anatomy is helpful for the position of the trachea and position of the esophagus. So these are the cross positions. After the successfully the introduction of the endotracheal tubes, means the following successful endotracheal intubations. So inflame the cuff using the room air at the proper pressures. So optimum approximate pressure of the cuff is 30 mm per Hg cm square. So over inflame of the cuff can result in the necrosis and means sloughing of the tracheal inner the lining. After the successfully the introduction, so finally the secure the ET tubes in the place with the piece of the cotton string, your waist IV set tied around the tubes and behind the animal head, you are on the top of the muzzle. So attach the endotracheal tube with the 5 mm adapter of the breathing suction with oxygen cylinder, your left for the inhale the room air. So now enter into the step 3. So step 3 is the administration of the propofol as a maintenance agent. 1% propofol as a dose rate of the 0.5 mg per kg per minute administered through the CRI up to the end of the surgery as a maintenance anesthesia. The IV node set can be adjusted according to the depth of the anesthesia required, decided by the during the monitoring of the animal's response. So as per the response, you can change the depth of the anesthesia. So you increase the flow rate or decrease the flow rate, but generally the fix at the continuous level. So this slide shows the how to set the CRI of propofol at the dose rate of the 0.5 milligram per kg per minute. So this procedure, this slide to helpful for the setting of the rate of the CRI for the propofol. So first load the 1% propofol as per the calculated ready-made chart and body weight of the animals, and enter means infuse into the 100 ml of the normal saline bottle. So first to take the 1% propofol as per the calculated body weight through the ready-made chart and infuse into the 100 ml of the bottles. And next step, to set the IV set now at the 60 dpm rate of the infusions. So what is the meaning of the 60 dpm? Means the 1 drop per 1 second. So fix it, and by after fixing it, then apply the medical adhesive tape. So it sets the 0.5 milligram per kg per minute rate of the infusion of the propofol, and it's connected with the 3-way connector, and one more 500 ml normal saline bottle can be fixed on IV stand for intravenous patency. So 100 ml of bottle is sufficient up to the 33 minutes at the 60 dpm, and after that period replace with the new bottle at a same rate. तैयार कर दीजिए. So all these balanced anesthetic protocol are standardized by the different institute under the constant monitoring of the various clinico-physiological parameters using the multi-para monitor and other sophisticated instrument like the recording of the ECG during the anesthetic periods. So all these balanced anesthetic protocol are standardized by the different institute under the constant monitoring of the various clinico-physiological parameters using the multi-para monitor and other sophisticated instrument like the recording of the ECG during the anesthetic periods. So out of this all the monitoring device, these 3 devices are enough for monitoring of the anesthetized the canine patient under the field conditions, and no need some costly and sophisticated instrument which are available at the institute levels. So at the field level, these 3 instruments are sufficient, no need the any other instrument. Start after the cessation of the infuse of the propofol, so de-inflammation of the cup of the endotracheal tube after the reappear of the salivating reflex, and carefully the withdrawal of the endotracheal tubes. So many clinicians they follow the withdrawal of the endotracheal tubes without the inflammation of the cup for the prevention of the aspirations pneumonia, but possibility of the tracheal injury to the tracheal valve and laryngeal region. Start after the cessation of the infuse of the. So I will show some photograph of the balanced anesthetic protocol using the propofol as a CRI in canine patient under the field conditions. So which will helpful for increasing your confidence regarding the use of propofol in the field conditions. So I will show successfully perform the amputation of the limb under the general anesthesia using the butorphanol and diazepam as a pre-anesthetic induced by the propofol till the effect, and finally the maintained by the propofol as a CRI in canine patients under the field conditions without any complications. So successfully excise the tumor mass under the above same mentioned anesthetic protocol in canine with the help of the NGO and UG student during the lockdown period. So demonstration of this balanced anesthetic protocol in dog to our UG students at the veterinary clinical complex during the OPD hours. And at the end of the webinar, following are the conclusions. So combination of the butorphanol and xylazine, diazepam, your midazolam provide the excellent quality of the sedations in the dog. The butorphanol and xylazine, your butorphanol diazepam, your butorphanol midazolam, so the potent dose sparing effect on induction dose of the propofols. So propofols produce the smooth and excellent quality of the inductions as well as the maintenance anesthesia without any complications. So you can use these combinations safely and effectively in canine without any significant alterations of the clinico-physiological parameter. So finally, the recommended the following balanced anesthetic protocols so can be safely used and effectively under the field conditions in canine patients. So India Chemist is a retail as well as the wholesale distributor of all the type of the anesthetic and narcotic drugs. They will be supply all the type of the drugs within the Gujarat and outside the Gujarat with the following mentioned documents. So distributor having the narcotic license and they will maintain the complete record of the narcotic drugs, so no bother about the maintenance. So if you want to purchase anesthetic drugs, then submit the following mentioned document with supply order copy. So easily supply this drug in your place. So India Chemist. And finally, the thank you all the participants who joined with us and carefully listened to me. So now the topic is open for the discussions. So anybody who asks the questions, write down in the chat box. So I will give the answers. So Dr. Nilofer, please ask the questions. Those persons are mentioned in the chat box. Thank you once again all the participants. Thanks.